Tibial eminence fracture are synonymous for a ACL injury in a pediatric population. It is classified by Meyer and McKeever. Type 1 is an undisplaced fracture. Type 2 is a displaced fracture which is anteriorly displaced, but the posteriorly the bone is in contact. Type 3 is a complete displaced, and type 4 is a comminuted fracture. Anyhow, these injuries happen in active population while playing sports or while playing football or cycling. When the injury happens, there is effusion in the knee and there is hemarthrosis. X-ray might show the fracture itself. For a quantification and following the treatment, we prefer to do a MR scan for the patient. The treatment depends on the type of injury which has happened. If it's a type 1 Meyer-McKeever, a cast-in extension is feasible. In type 2, there are some papers which have shown aspiration of the knee itself and continuation with the cast treatment. Anyhow, with type 3 fractures, there is a clear consensus to have operative intervention because the patient will lose adequate extension if they are treated non-operatively. The operative intervention can be either Arthrex um, uh, fiber tape, which is crossing through the distal ACL, going through the fracture site and fixed distal to the epiphysis. The second option which is possible is to put a Harbor screw if there is a large fragment with arthroscopic guidance. And the third option to put a partially threaded screws which can be crossing through the tibial eminence. All these treatment depends on the type of injury which is identified on scans.